Okay, hi guys. So, I had some great questions this month, so we're going to dive into it and answer these questions and solve some problems. So first off, a couple of solid questions here from Paula. Hi Paula. So she says, is it to be expected that exercise prescribed in rehab can stir up the pain initially and you should preserve through the pain, or is it an indication that they are not the right exercise for the problem? Short answer is, obviously what we're trying to do is solve the problem of pain, not create pain. So if we're getting pain from the rehab program, we're going wrong somewhere. So it could be the wrong exercises, it could be a breakdown in technique, like mistakes being made in technique, or it could be aggravators and pain triggers around the exercise program that are still sensitizing the back to pain. So obviously what we need to do is two things, is one, have a solid initial assessment to find out exactly what our pain triggers are, so we know the things we need to avoid and things we need to work on, because that then basically sets the rules of the game for any exercises we do and things we need to do day to day. And then also understand the idea of the analogy of a bank account. So the bank account is basically the amount of work or aggravation your back will tolerate before we start to get pain and problems. So what we need to do is minimize the withdrawals in that bank account as much as possible, so that we've got enough to get through the day, but also a little bit extra then to spend on the rehab program. Because although the rehab program is designed to build a bigger bank account long term, it does make some withdrawals in that bank account. So we need to be careful that we don't overcook ourselves, and make sure we've got the best chance possible to have a nice big bank account. So we've got the room there, the spare, safely to do the exercises we need to do and recover from them as well. But if you're getting pain, it means you're missing something somewhere, and that's where the benefit of an initial assessment, especially with provocation testing, that tells us exactly what we should be avoiding day to day to spare that bank account. If we don't do that, then you're kind of flying blind and you're going to get into trouble and not be able to fix it and kind of get progress either. So again, always comes down to, it depends. And it really does depend on that initial assessment, so we can kind of set the rules of the game for you in your back pain, and understand exactly what we need to avoid and what we can and can't do exercise-wise. She also asked an awesome question as well. When an area has been chronically inflamed and painful for many years, is there benefit to getting a corticosteroid epidural to reduce the pain and facilitate engagement in exercise rehabilitation? So again, it depends. Sometimes, for sure, you might need to. A good way to tell is if you've got constant pain that never changes, like you never have good days or bad days, or good times of day versus bad times of day, then yeah, you're probably going to need some sort of medical pain intervention for sure. But generally, again, it comes back to that initial assessment. If you identify and remove your pain triggers and aggravators, that starts to let the back, settle and desensitize the pain straight away from that. The only danger is as well, because again, sometimes we may need to, but if we do, we just have to make the educated decision that with anything, there's always a trade-off. And the trade-off with that is once we have medical intervention to mask pain, we're not going to get the feedback when we're doing stupid stuff with the back that it doesn't like. So there's always a danger that, especially with the injections, is that you might get a few weeks or months of pain-free bliss almost, but because you're not getting the pain feedback when you encounter your pain triggers or aggravators, you may do more of the things that are irritating the underlying issue. So when that injection wears off or that pain medication wears off, you might be in a worse position. That's always a trade-off. But there are some times where you might need to have some sort of pain management to be able to get you moving again and start getting you on the right path, but you need to do it with kind of full awareness of the context, the trade-offs. But either way, you must have identified your pain triggers and your aggravators first, so there's no danger of you aggravating stuff in the background without realizing. So again, sometimes, but again, still that initial assessment is paramount. You've got to start with that first of all, know what the rules of the game are for your back, that then underpins everything else that we do going forward. Great question now as well from Andre. He said, can you please explain in the video why do you use hanging in back rehab? So there's a couple of reasons why you might want to use hanging. So those from the work of Professor Stuart McGill and also Pavel Tsatsouline. I've probably butchered his last name there. He's the guy who was kind of brought sort of kettlebell training to the forefront in the early 2000s. There's a good case of those guys working with Pavel's father, I think it was 75 at the time, to basically develop a strong back, but also get back into deadlifting. I think may have even tried to set an age-appropriate record for his deadlift as well. and they used intraset hanging. So they would do the deadlifts, hang for a bit, deadlifts, hang for a bit, deadlifts, hang for a bit. They basically mitigate the amount of compression that was going onto his spine and his discs. So it can be a great tool for that. So anytime you're doing things like deadlifts or in particular squats as well, you can kind of add hanging in between. Another way to do it is with squats, you can superset squats with chin-ups or pull-ups. They'll have a very similar effect. Basically what you're just trying to do is mitigate that compression on the discs in particular, and that builds you a bit more workload tolerance. So it's a great way to manage that and get back into heavy lifting without overcooking yourself. The second thing that we can use it for, and again, most people now generally don't just have lower back issues, they've also got upper back, neck and shoulder issues because they've got poor upper body posture and tight thoracic spine and all sorts of problems. It can be a great tool to help with thoracic posture, but also shoulder health and grip strength as well, provided you can actually get your arms into that position safely and you haven't got any sort of tendonitis or bursitis that needs to be addressed first of all, and you've got the range or reasonable range to get there. General idea is you make yourself strong at that very end range of your shoulder, and you feel stable there. Your shoulder is going to be pretty solid all the way through the range for sort of day-to-day stuff, to get less problems. And it can also is a good tool to develop grip strength endurance as well, particularly once we start doing single arm hanging. So hanging, good for decompression, where you need to use decompression to help mitigate workload. Great for upper body work, providing you get your shoulders up there. Also great for developing grip strength endurance as well, which again is pretty important for most people. But again, right tool for the right time, for the right person. It's not going to work for everybody, and for some people it's going to make their issues worse. So just be careful how we engage and use those tools and select the appropriate ones at the appropriate time for the right person. So quick summary, should you get more pain from your rehab program? No, something's going wrong somewhere, so we need to address that. Can injections or pain interventions with injections help? Sometimes. Just be aware that if you mask that pain, you might do more of the things that irritate your underlying issue. And hanging, great for decompression, great for upper body rehab as well, particularly shoulders and thoracic spine and even neck issues to a degree. Also great for grip strength, but again, not for everybody. So again, great questions this month, so I'll probably do some more next month as well. But hopefully you found that useful. I wasn't too waffly as well. But yeah, again, next month we'll do some more, so get those questions coming in.